Well, that's another subject. So today we're here for a National Day of Action, and I want to thank everyone that's here because this event is taking place around the country today in other locations. It's taking place in Washington, Pennsylvania, West Virginia, Connecticut, and online. And our prayers go out to North Carolina because unfortunately with the hurricane, their devastation, their event had to be canceled. We have a lot of guests with us today, and I want to make sure that I include everyone. So be a hero. Thank you, because we could not have done this without you. Petitions for a National Health Plan. People's Action. Center for Popular Democracy. New York Progressive Action Network. Citizen Action New York. Northwest Bronx Community Clergy Coalition. CROC. New York Statewide Senior Action Council. ACT UP. Radical Elders is here. And the Campaign for New York Health. I want to thank everyone for joining us because this is a national day. Gotcha. So I want to explain this event today. This is a two-part event. Here at City Hall, we are focused on Mayor Eric Adams and the New York City retirees as we've been fighting Medicare Advantage for the last 3 years. Yet, no matter how many court cases we filed, and there's been 3, and no matter how many times we've won in court, there's been 9, including 2 unanimous appeals decisions, this mayor consistently appeals every court case that he's lost. Everyone knows he's been in the news lately, misusing our money just like he has been before, I guess. But New York City retirees know that he has been influenced by the 2 largest unions in the city of New York, as well as Aetna and their lobbyists. We're being forced on an Aetna Medicare Advantage plan. This is because the mayor is trying to control our health benefits and take away the promise that's been made to us. And we have urged him that promises made should be a promise kept.
Promises.
So today we are going to stand in solidarity with these national organizations that are here with us today. And in part 2, we are going to march up to Aetna. Some of us will take a bus, those that can't walk or take the subway. We are headed up to Aetna, and we will then protest against corporate greed. So I am very glad to have all of you here with us today. I also want to explain to you why we don't like Medicare Advantage for many of you who are here for the first time. Councilman, nice to see you. Councilman Marte. So we do not like Medicare Advantage because of the wrongful delays and denials of care, the limited networks that we can't see the doctors that we want to see, only the ones that are in the network for Medicare Advantage. If the doctor doesn't accept the MA plan, you have to pay the doctor out of pocket and hope to get reimbursed by Aetna. We have rare prior authorization in traditional Medicare. In Medicare Advantage, there are many prior authorizations and there are 5 levels of appeals. This is not what we were promised. We were promised for decades that we would have traditional Medicare. Medicare Advantage isn't Medicare, and it isn't an advantage, and that's our position. Today, we are going to be hearing from Bill Shenton, Dr. Don Moore, Megan Bent, and Roberta Gonzalez. Our first speaker is William Shenton, New York City retiree.
We don't get it. Shut it down. We don't get it. Shut it down. We don't get it. Shut it down.
Thank you. Hello, everyone.
Hello.
I'm William Shenton, a December 2000 Housing Authority
Come closer.
Housing Authority retiree. I live in New Jersey. New York City promised me and my wife Susan premium-free Medicare A and B
What free?
with supplemental insurance for life. In 2001, New York City broke their promise when they told us we would be put into a Medicare Advantage plan unless we paid a $195 per person per month premium to keep Medicare A and B with senior care. Eric Adams was a candidate for mayor at the time and called the proposal bait and switch. After being elected, he switched and now supports the Advantage plan. I've had some bad experiences with Medicare Advantage. Susan's mother had an Advantage plan. When she had to move to a nursing home, The social worker there told Susan that her mother had to be on traditional Medicare A and B. Susan could not enroll her mother in a supplemental plan and had to use her small IRA to pre-plan funeral arrangements and pay the 20% patient responsibility. In a few months, the assets were gone, and her mother had to resort to Medicaid. Susan had an immune system disease. Her rheumatologist prescribed a medication that costs over $12,000 a month. My union drug coverage has a family ceiling of $30,000 a year. Susan had to buy a Medicare drug plan so she could continue her medications. Advantage plans don't allow individual drug plans. We were told that Susan would have to use my union drug coverage. After 2 months, we would not have been able to afford her medicine. I contacted Deputy Commissioner of Labor Relations Claire Levitt about this, but was never given a solution. Traditional Medicare covers every doctor and hospital we've ever used. Susan was hospitalized last year and remained so for most of the 5 months until she died in November. The explanation of benefit letters from Empire Blue Cross noted that our hospitals were out of network. That didn't matter. Because we had traditional Medicare, Empire paid. Those were the hospitals where our doctors practiced. I could not verify that our hospitals or doctors would accept this advantage plan. With traditional Medicare, most of this country is in network. Access to adequate health care is a human right that should not be controlled by greedy, for-profit insurance and drug companies. I feel betrayed by Mayor Adams and my former union who agreed to this. I joined in the New York City Organization of Public Service Retirees fight with Mayor Adams. We've won 9 times in court, yet Adams keeps wasting everyone's money on appeals. Mayor Adams, drop the appeals. 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 Thank you, everyone.
Thank you, William. And now I would like to introduce Dr. Don Moore.
Good afternoon, everybody. Well, I'm fired up just like the rest of you because I'm on Medicare. As a representative of the 20,000 strong physician for a national health program, I want to tell you that we oppose the privatization of Medicare. Medicare is one big insurance that's national. Medicare Advantage are multiple fragmented insurances that are state-specific and even county-specific. So we end up with narrow networks when we have Medicare Advantage. No, we don't want Medicare Advantage. So the first thing you're going to lose if you lose your traditional Medicare is choice. You're going to be in a narrow network. As a physician, when I ordered tests, quite often I would get the rejection of payments for those tests, not medically necessary. That's what happens when you have Medicare Advantage. Ooh, we don't want Medicare Advantage. What about portability? What do I mean by that? Portability is I work in New York, but I retire in Florida.
That's right.
Is my insurance gonna go with me?
That's right.
No, I said Medicare Advantage is state and county specific. Yeah, they may make a deal with somebody in Florida, but it won't be covered in the same way. It's gonna cost you more. So the answer is, well, the question is, Well, why are those people asking me to switch from my traditional Medicare to Medicare Advantage? Right. Cost. They tell me it's going to cost less. Well, let me inform you. That would be penny wise but dollar foolish. It will cost you more in the long run because a lot of your procedures aren't going to be covered and you're going to be stuck with the bill. I want to encourage all of you, advise you, don't give up your traditional Medicare. If you do, you're going to lose access. You're going to lose choice. You're going to get unequitable care. Why unequitable care? Because the rich people have Medicare and the poor people have Medicare Advantage. The rich people have private insurance and the poor people have Medicaid. We fragment our insurance so we can give different care to different people. We should all get the same care. So I encourage you, don't be fooled. Don't be trapped into Medicare Advantage. You're doing well if you have traditional Medicare. Keep it. What we need to fight for is an expanded Medicare, traditional Medicare for all. Thank you.
Hey, hey, ho, ho, Medicare Advantage is got to go. Hey, hey, ho, ho, Medicare Advantage is got to go. Hey, hey, ho, ho, Medicare Advantage is got to go. Come on, hey, hey, ho, ho, Medicare Advantage is got to go.
Thank you, everyone. Now, our next speaker is Megan Bent. Megan.
Hey, hey.
Is this volume good? Yes. I'm here to speak about what happened to my father, Gary Bent, and to our family. I want to start by sharing about who he was. My dad was a peace and social justice activist, a teacher, a mentor, an amazing dad. He was a Connecticut state retiree. He did not choose Medicare Advantage. He was put on this plan. In June of 2022, when he was 81, his melanoma returned as a bleeding lesion in his brain. He came out of brain surgery, unable to walk, not knowing he had a left side of his body, and he couldn't even remember if we had visited him in the hospital. He was in a very fragile state, and our nightmare was only about to get worse. His neurosurgeon unequivocally recommended that he go to a specialty rehab hospital for recovery, and that hospital accepted him as a patient, knew that they could help him, but insurance, Medicare Advantage, denied this.
Shame on that.
Shame on that, right.
Shame, 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 shame.
They made my father go to a substandard facility. And even when he was there, they kept trying to kick him out and discharge him while he was working so hard to recover. In the 49 days that my dad was at short-term rehab, we experienced 3 attempts to end his care. And we fought those appeals, or we appealed those denials. We won 2 appeals and we lost the 3rd. And my dad was discharged. My dad came home with a fever, complaints of a headache, and a sore neck. He had been discharged with bacterial meningitis, and he was immediately rehospitalized. He was in the hospital for 3 weeks in critical condition. He was in isolation. There were times that we didn't know if he was going to make it through. He did make it through the meningitis, but he lost all the gains he had worked so hard for in his short-term rehabilitation. And he was never able to get strong enough to go back into cancer treatment. And so we brought him home, and my mom and I took care of him until he passed away. We later learned that a lot of these denials were because Medicare Advantage is running through medical decisions through an algorithm, using bots, listening to bots, instead of the doctors who knew my dad.
Right.
Living this trauma, witnessing this trauma, opened my eyes to the cruelty of privatized Medicare. So I'm here today to continue to fight for my dad and to honor his legacy as a social justice advocate. I know that denying my dad's care increased profits somewhere, but it stole things from us that are invaluable. Quality time together, dignity. Going through all of these denials, having to continually appeal, it would continue to upend our lives and cause so much stress and trauma. So I'm here today to ask you to continue to speak out and fight for those who have passed but deserve better, for those who are with us today, that they get the care they need when they need it. No denials, no AI, no Medicare Advantage. Medicare is a social system that is supposed to be here to protect us all and provide us health care for all, and we need to return it to that. Thank you.
Adams, hear my plea. Don't take my care away from me. Adams, hear my plea. Don't take my care away from me. Adams, hear my plea. Don't take my care away from me.
Well, you might be
Michelle.
going away.
Well, and I want to make it crystal clear, in the Aetna Medicare Advantage plan that Mayor Adams is trying to force us into, the contract does allow for AI to make decisions in our healthcare. Our next speaker is Roberta Gonzalez. Roberta. Behind me? Yes.
Hi, good afternoon, everybody.
Close to your mouth. Close to my mouth. All the way. You want me to hold it? I'll hold it. It's all right.
Sorry about that. I'm here to say that in 1973, when I was about 19,
Nice and strong, right into that mic.
I'm sorry, I have a bad.
That's
You got it.
Yeah, I need my Medicare.
They didn't know that.
Hey,
Now they know.
in 1973, when I was about 19, I had passed the civil service exam, and shortly thereafter, I was offered a civil service position. I accepted it. And when I did, I took an oath as I was sworn into city service. I promised that I would faithfully discharge the duties of my position according to the best of my ability. Initially, I attended many trainings and many benefit sessions, and those benefit sessions led me and all my fellow civil servants inductees to understand that we would have a reciprocal relationship with the boss, New York City government. I had a clearly defined job description. I had to read the city rules of conduct, pick up Medicare providers, medical providers, and sign on for a pension and join a union and learn my job with just a few weeks of being hired. I became a civil servant, a municipal city worker, one of thousands who keep the city running, who provide services and give care in and out of the public eye. We are generally a dedicated and caring group. After all, we make the city run. The garbage does get picked up by us and not by Wall Streeters in ivory towers. We municipal workers and retirees are representative of the various peoples and communities that we serve. I worked hard and responsibly for the city. We city workers do work hard. I worked hard to make the city run the best way it can because I live here. City workers, we live here. Our families and communities are here. And we wanted to and still want to make a positive impact on our city and the world by doing the best we can. I know that that's why I came to work for the city of New York with a starting salary of $5,200 a year. I knew I wasn't going to be rich, but I knew I'd have a regular salary, health insurance, and that I'd be paying into a pension system. And I was promised that I'd have health care that would help me live as a retired person. We often made personal sacrifices to work in the jobs that make the city work. There were and still are many challenges to getting these jobs done. I worked a lifetime for the New York City Department of Health and Mental Hygiene from '73 until 2011. During the New York City transit strike in 1980 and in 2005, I found my way to work and got my job done. During the blizzards that dumped over 9 inches of snow on the city, I managed to find ways to get to work and get my job done. During the fires and riots in the 1970s, I found my way into work. I and fellow co-workers worked day and night to get a TB clinic up and running in Bushwick. In the late 1980s, when HIV and AIDS was causing fear and people were dying from this new scourge, I and my fellow co-workers worked day and night to raise funds and bring HIV and AIDS information and counseling and testing and prevention programs to life. We wrote grants and submitted them everywhere to get funding for focus groups, for program development, and for an AIDS hotline. We worked through needle exchange controversies and gay rights protests, and we attended every city council hearing to bring attention to what was happening to the folks who might be able to help. Over my almost 40 years of working for New York City government, I and many civil servants put our lives and our health, physical and mental health, on the line, sometimes almost daily, so the city could run. These jobs are not easy. Most of us work very hard to develop and maintain services, provide for the health and safety of the people, and educate children and adults, as well as govern and create and protect the laws of the city. During the very frightening anthrax events and 9/11 terrorist attacks and other adverse events, I and many others sacrificed our physical and mental health and well-being. And there are those who even bravely and amazingly sacrificed their lives for the good people of this city. And the expectation, the promise, the understanding has always been that there would be benefits that would help us get through the adversities that could arise as a result of our jobs. And those benefits would be there to compensate us or our families for our sacrifices and would remain with us even into retirement. So here I am with lung cancer and thyroid cancer related to my work for the city during 9/11. And here we are, I and 250,000, a 250,000 fellow retirees, many with similar stories and work-related illnesses. Here we are with the understanding that we would have our promised benefit of original Medicare and city-funded Medicare plan to carry us through our retirement. But now, when I am older, when we are older, when we already played the game and we did our jobs, when I and we made the sacrifices that our jobs required, when I worked during those anthrax events, TB outbreaks, HIV and AIDS crises to develop those prevention, counseling, and testing programs, when I already burned the midnight oil with my colleagues post 9/11 to write grants, develop infrastructure and restoration programs, radiological detection and biological warfare medical protocols, and plans to protect the city in the future. And now that I have these two cancers related to my work for the city during 9/11 and desperately need my Medicare and city-funded supplemental insurance, I and 250,000, 250,000 or more of my colleagues are being forced by the city to make new healthcare decisions that can mean life or death for each of us. The city is trying to force us into Medicare Advantage program. Medicare Advantage is not Medicare, and it's not an advantage to anyone except the investors and the company's profit margin.
Right.
Hundreds of investigations have shown that these companies delay and deny care, causing harm and even death to those insured by them, as well as imposing additional and surprise costs, in and out network delineations, and confusing requirements. If, as former Vice President Hubert Humphrey said in 1977, the moral test of government is how the government treats those who are in the dawn of life, the children, and those who are in the twilight of life, the elderly, and those who are in the shadows of life, the sick, the needy, the handicapped. Then, New York City government, our former boss, is being tested and is failing that test by breaking its commitment, its promise to us, after we kept our promise to the city. This is unconscionable. When current workers see how easy it is for the city to go back on its commitments, to bait and switch with unkept promises, how will those workers feel about making any necessary sacrifices for the city? Who will they trust? Who will be compelled to act to protect the city and its people when the city shows that it does not uphold its end of the bargain?
Right.
Thank you.
Thank you.
So what do we want? So what do we want?
Medicare.
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 When do we want it?
Now.
When do we want it?
Now.
And when do we want it? And when do we want it?
Now.
We don't get it.
Now.
We don't get it.
Shut it down.
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 Thank you very much.
Good
What I-
day.
What I want to let you know is remind you 20, 30, 40 years ago, we did not have Zoom or Teams. We had to go to work. People like Roberta had to go back to the office in the days after 9/11.
Yes.
We ran this city. We built this city. We rebuilt this city. And unfortunately now, after we made our deals and left our city agencies in retirement, they are then trying to renegotiate the deal that was made to us, and it's well too late. We need to make sure that we keep the promise made is a promise kept.
Promises made.
Promises kept. Promises made.
Promises kept.
Promises made.
Promises kept. Promises made. Promises kept.
We have a special guest that just joined us, Councilman Christopher Martin.
All right.
Hi everyone, I'm Councilmember Christopher Martin and I represent Lower Manhattan. I want to say thank you to everyone that's standing here today because you are representing thousands of your former colleagues who can't walk and get here, who live across the country and are praying that our mayor does the right thing. So I want to thank you because I know this fight has been long. I've been outside with you in the rain, in the blistering heat, demanding to protect your right to your health care plan that was promised to you.
We worked for it.
Exactly.
We paid for it.
That's right.
And Roberta, I gotta say, you gave probably one of the greatest speeches I have heard. And I wish you can email that testimony to the mayor himself because she said it. She sacrificed her life. She sacrificed her resources when nobody wanted to live in New York City. When we had thousands of people moving to Long Island, to New Jersey, you remained. When our public schools were crumbling, when our fire departments didn't have fun, you stayed. When we had crisis after crisis, natural events happening like Sandy, you stayed and cared. And what is our administration doing now?
Turning their back.
Turning their backs on the very people that made this city what it is. I remember when I started in the city council, they said, no, it's a financial decision. We can't do this because it costs the city so much. But every single year I've been in the council, our budget has only increased. And what have we used it for? Not for the people that need it the most. And so I am here saying that I am standing with you and I am organizing to make sure that you have a right to stay, you have a right to your care, and you get the love and respect and the dignity that you deserve. I also want to shout out former Assembly Member Dick Godfrey, who knows a little bit about healthcare. Thank you, Dick, for being out here.
When they say cut back, we say fight back. When they say cut back, we say fight back. When they say cut back,
We say fight back.
when they say cut back,
We say fight back.
when they say cut back,
We say fight back.
when they say cut back.
We say fight back.
Thank you. So I'd like to make some ending remarks, and then I'm going to pass the microphone to Mandy to tell us what phase 2 is going to look like. So these are the demands that we are making of Mayor Adams. Tens of thousands of people here in New York and across the country have sent our demands to Mayor Adams, and so far we have not heard back.
You got problems.
Here's what the mayor, but
I'm sorry, Marianne.
here's what we need Mayor Adams and the city of New York to do. Stop forcing retirees into Aetna's Medicare Advantage plan and immediately withdraw the appeal in the Benkowski versus City of New York case. Commit to honoring the promise made to retirees by ensuring premium-free access to traditional Medicare and our senior supplemental plan. Commit to not increasing the cost of health benefits to public service retirees by withdrawing your appeal to the New York City Organization of Public Service Retirees versus Campion, our first case. Immediately rescind the decision to charge retirees a $15 copay for each interaction within the healthcare system. That's our second case. We have 3 cases altogether.
Winning.
We have, but he still appeals every loss. We're headed up to Albany next. Hold a public town hall meeting with retirees to hear retirees' concerns and engage in good faith discussions about the future of our promised benefits. Publicly state your support for a resolution in the City Council to never strip retirees of our promised benefits, specifically by ensuring access to traditional Medicare with a supplemental plan. Publicly state your support for Senate Bill 8388 and Assembly 7866, which would prohibit public employers from diminishing health benefits for retirees by forcing them into privatized so-called Medicare Advantage plans. Publicly state your support for federal legislation that would expand traditional Medicare to cover vision, hearing, and dental benefits, add a cap on out-of-pocket expenses for beneficiaries. And I do want to make a note before I continue on to the next point, is that there was actually a New York City Council resolution to that exact same thing a couple years ago. Also, supporting reducing Part B premiums and recouping overpayments to insurance companies offering Medicare Advantage plans, because we know that these plans have been upcoding and overcharging the federal government, increasing the drain on the Medicare trust. Publicly state your support for federal legislation that would remove the word Medicare from the name from Part C plans, because we know they're not Medicare. Anything less is a broken promise to retirees. Our fight to get what we were promised continues. On October 10th, we have another rally right here at City Hall, and we'll be announcing that tomorrow. So make sure you put on your calendar, October 10th.
I'll be there.
A bill will be introduced in the council that day, and I need you here. On October 16th, we'll be back in court fighting our fight against the $15 copays that are being charged for every interaction in the healthcare system. Of course, that when they did this the first time to us in 22, amounted to a car payment to many of you. That's penalizing people who need their healthcare. As we continue our fight here in New York City, a whole movement of national organizations, like I mentioned when we first started, are with us today. Now we are going to head to Aetna to demand that they stop their corporatization of our healthcare system. And if you can join us, we'd love to see you there. If you can't, we totally understand. I'm going to now pass this microphone to Mandy, who is going to talk to you about the logistics, because we are headed up to Aetna on 6th and Spring, and she will tell you